welcome to the show. We did tell you that this day, this Health Tuesday segment of The Only Way to Start Your Day, Good Morning Kenya, we shall be looking at cervical cancer. Why do we need to be looking at this? A survey was conducted and the results released last year around October, that's 2016. Shocking statistics, very shocking. Why? 15 women diagnosed with cervical cancer every week. No, we need to talk. And only a whooping 97% of women do not understand what exactly causes cervical cancer. The amount of information they have about this particular condition is limited, and even in some cases, non-existent at all. What is the problem? What is the issue? How do we move on as a country? There was that summit that happened in Nairobi last year, and some of these issues were discussed. The guest of honor was the president. The first lady was also there. And we're going to look into issues to do with vaccination, HPV, and also listening to the story of a survivor who has bravely overcome this particular condition. We also do have a policy maker, and I will introduce them right now. I've got David Makumi, I beg your pardon, from the Kenya Network of Cancer Organizations. Welcome to the program, sir.
Thank you.
To my extreme left, I've got Gladys Mureithi, a cancer survivor. Welcome to the program.
Thank you.
How are you?
I'm fine, thank you.
You're doing well. We were expecting the presence of Dr. Nelly, a gynecologist as well as an oncologist, but due to unforeseen circumstances, I am reliably informed that she will not be joining us this morning. Wish her all the best wherever she is, but let's continue with the conversation and begin with you, Gladys. Just tell us a little bit about yourself.
First, my name is Gladys Mureithi. I'm 46 years old. I was diagnosed with cervical cancer, stage 2B. That is in 2013. I went through chemo, radiation, and even I did a TAH. We did an operation. And I thank God that now, 3 years down the line, I'm fine.
Mm-hmm. That was stage 2B.
B, yes.
That was in 2013.
Yes.
When did the operation happen?
In 2014.
In 2014, Feb.
Yes.
We shall talk about that in a while. But coming to you, David, from the Kenyan Network of Cancer Organizations, where could the problem be? We're talking about 15 cases every week.
Yeah.
97% of women not knowing or not having sufficient information on cervical cancer. Anyone would ask why?
There are a number of reasons. And if we look at the bigger picture, we have 4,800 women diagnosed annually. Mm-hmm. And out of that, we lose approximately 2,500. Mm-hmm. So actually more than half to cervical cancer. And the fact that cervical cancer is a very, very treatable disease. That's one, that she's a living testimony. Mm-hmm. And two, it's a very preventable disease. Mm-hmm. Three, it's a disease that we can catch early. Of all the cancers that there are, it's one of those we can catch very, very easily and catch it very, very early. There's a lack of public awareness in the communities. Actually, the Ministry of Health conducted a survey. It's called the STEP survey with the support of WHO and World Bank. I think it's 2 years ago. It showed that actually less than a quarter of Kenyan women have ever had gone for a cervical cancer screening test. And if you look at it, we have just about 15 million women aged between 15 and 50. Mm-hmm. That's a huge number. And that's the population at risk. Mm-hmm. So it's a huge population. So lack of awareness is actually one big. The other thing that also drives the numbers is also stigma associated with cervical cancer. There's the symptoms of cervical cancer, as it were. Women will present, with bleeding, sometimes with discharge, the lower abdominal pains. They are non-specific signs. Sometimes they have pain even after intimacy, and since those signs can also be signs of other infections, and given that they are related to the reproductive system, as a country and our cultural orientation is such that things to do with sexuality are not things you talk about
in public.
In public. And you'll find that women, especially in low socio-economic situations, living in poverty or in slums, may not have access even to screening. And these are the same ones, or even in the rural areas, who will not talk about symptoms related to reproductive system, and if they develop those symptoms, so you find their husbands or their loved ones start shunning them. So if you have a discharge, for example, it may be insinuated that is sexually transmitted. And true, cervical cancer, the leading cause of cervical cancer is the human papilloma virus.
HPV.
The HPV. And that HPV, there are many types. There are almost 100 types of HPV. The one that we are worried about is the type 16 and 18. It's sexually transmitted, and a lot of people, majority, all of us will get some HPV infection at one time or another.
Allow me to interject, because in the course of preparing for this interview, even talking to some people, they believe that cervical cancer is sexually transmitted. Can you confirm or otherwise?
Yes.
This morning?
Cervical cancer as a disease is not sexually transmitted. Cancers, all cancers are not communicable. You cannot transmit cancer from one person to another, just like you do with HIV or with hepatitis B virus. You cannot do that. It's not a communicable disease. It's a non-communicable disease, including cervical cancer. However, the virus that causes majority of cervical cancers is the HPV virus, is sexually transmitted. Just like the virus that is associated with hepatitis. It's bloodborne, it's transmitted sexually, can also be transmitted through blood, So it's not the disease that is sexually transmitted, it's the virus associated, the virus that causes that disease. In other words, there are actually some people, a small percentage of people who don't have HPV infection, but they still get cervical cancer.
Cervical cancer.
Yes.
I'll come back to you on the issue of HPV. Gladys, let me come to you in terms of your story.
Yes.
Talk to us about the quality of your life before 2013. How was it? How was your day-to-day life?
Yes. Mine, I can say, okay, let me start from 2010. I got my last born through CS. During delivery, the cervix couldn't open well, so we had to go through the CS. And after 1 year, I got my periods normally after 4 months. I started receiving my periods and went on very well, just the normal way. But after about a year, I missed my periods. Did the pregnancy test, I was not pregnant. And after about 3 months, still taking these pills for family planning. I used to take the pills. I went and saw a doctor and asked him, is menopause coming at 43? And he told me, no, it can't be even 40s, no. And I said, okay, I missed my periods. I'm more than 6 months now. I've not received my periods. And the doctor advised me to do an estrogen test. When I did the test, it proved that my ovaries were still producing. So he advised me to do some more tests to certify why I'm not getting the periods. I didn't take it seriously, and I took my time. After about a whole year without getting my periods, I started having a discharge, like I'm not able to hold my urine. I went to another doctor, and the doctor sent me to the physiotherapist to hold my muscles so that I can be able to hold my urine, which I did for about a month. And then there was no change, so I gave up. When I gave up, it took me another about 5 months. And then the discharge started having a certain smell. So this made me uncomfortable. So I decided to go and see another gynae. When I went to the gynecologist, the second one, she told me, Gladys, have you ever done a pap smear? And I told her, yes, about 6 months ago. And she told me, Gladys, we need to repeat it. So I went, had a pap smear, and when I went back to my doctor, she told me, Gladys, we have cancer cells growing on your cervix. That to me was like a bullet. I've never been shot, but I felt like, God, I'm dying now. And she told me, no, Gladys, this is not the end. We need to do some extra tests to confirm it. So we did a biopsy, and we did an MRI, which showed exactly where the growth is and how big it was. And then she advised me, we start the treatment. So from there, now I went and she referred me to an oncologist. And now we did the radiation. I did 25 sessions of radiation. I did chemotherapy, 6 sessions. And when we finished, the doctor advised that we do a repeat MRI to see the position now. I went for the repeat MRI after 3 months, which showed that the growth had reduced from 4 centimeters to 3.5 centimeters. The doctor told me that the drugs are still in the body, so they will continue working slowly. So he told me to repeat the MRI after 6 months, after 3 months again. So after the 3 months, I went back for another MRI, and the growth now had increased from 3.5 to 3.8. So they advised me that we need to do an operation to get rid of it because it's not responding to the drugs now. We need to get rid of it. So I went on 15th February 2014. That's when I did the TAH.
Which is a total abdominal hysterectomy. That's removal of the womb.
Yes. So I went for the operation, which went on very well. We removed the
uterus.
The uterus, yeah, the ovaries, this. And I said, if that was the way out for God to heal me, I thank God. I went for it. I thank for my family, which was so supportive. They supported me throughout the treatment. My husband, my daughter, my parents, my sisters. The crowd was big. They all stood with me. Even the colleagues in the office.
Yep.
They really stood with me. And they supported me. They advised me to be positive about it. And I thank God. That's why I'm here.
So far, so good.
Yes.
So far, so good. And you know what? We're taking a short break and we'll be right back. So kindly keep it right here. In case you've got any questions, 22162 on SMS and hashtag Good Morning Kenya on Twitter. We'll be back in a moment. Welcome back to the program. I'd like to cross over to you now, David. And HPV is blamed or is one of the causes of cervical cancer. However, a majority of the women with HPV do not get cancer. That's a piece of information I came across, or do not get cervical cancer. Explain to us how that works.
Yeah, actually, as I had stated earlier, HPV is primarily the cause of majority of the cervical cancers that we see in this country and across most of sub-Saharan Africa, most of our parts of the world. But just like many other cancers, a lot of people who will have a transient infection with the transient passing infection with HPV will not necessarily get cervical cancer. You know, our bodies are able to fight that off. And if you are to look at cancer in general, our bodies are always fighting, not just cervical cancer, all sorts of cancers. You know, we are able to, our bodies are able to deal with the damage to the DNA, but in a number of people, especially because of either immune suppression or presence of other risk factors, repeated infections, they will actually proceed on to develop cervical cancer. And we do have now tests to determine whether there is presence of HPV using HPV DNA. DNA testing is actually one of the screening methods, albeit a little expensive. So the mere fact that there is a risk factor present in any person does not necessarily, a risk factor is anything that increases the likelihood that you will get the disease, but not necessarily that you will automatically get. So there are lots of people who will have some risk factors and not necessarily develop the disease, but there are others also without a risk factor that will develop the disease. But majority of those with cervical cancer probably have an associated infection with HPV. And the fact that you get an infection today doesn't mean you get cervical cancer tomorrow. The process is long. It's actually a long process. So you may have repeated infection now, but we only see cervical cancer in the next 8 years, even up to 10 years. That's when you get the disease, the actual disease. So the changes in the cervix actually take a long time to change from normal to cancer. And that is where screening comes in. We are able to catch these changes. You know, you have almost like these 10 years between infection and developing the actual cancer that we are actually able to catch, to get those cells through a pap smear to say, yeah, these cells have changes, suggesting that sooner or later this woman is going to develop cancer. That's why we encourage women to actually do their pap smear. So it's a disease we are able to catch so early that if just when the changes are starting to happen, even before they become cancer, you're able to say these cells are not normal, and they are following a trajectory that will make them cancer in the next couple of years. So we are able to deal with them at that point, long before they become cancer. So if you see a woman with a cancer today, cervical cancer, that has been associated with the HPV, then that infection occurred years back, maybe 80 years earlier. Yeah, so we have a golden opportunity to get our women actually screened, and there are different modalities that are low cost, available in all our facilities.
Yes.
Yeah.
Let's talk about the breath of fresh air in this conversation. Now, the first one, you've highlighted it, that if it's arrested early,
yes,
it can be treated.
Absolutely.
There's also another breath of fresh air, and it touches on vaccination.
Correct.
And it can be administered to young girls.
Correct.
There was a pilot in 2013 done in Kitui County.
Correct.
It was successful, and it was agreed that this be rolled out across.
Correct.
What has been the progress of vaccination against cervical cancer so far since 2013?
Good. The vaccines that are used against the HPV virus are actually available in this country. They were approved actually in 2006, and they've been available in this country for a couple of years. The two vaccines, they are right now they are available, at a cost to the user. The cost is just about 2,000 to 3,000 shillings, depending on where you go to get the vaccine. So the ministry did conduct a pilot that you alluded to in Kitui, which was very, very successful. And I know as an organization, the Kenya Network of Cancer Organizations, we were part of the multi-agency task force that was working on our proposal to Gavi with the Ministry of Health and many other stakeholders, the Department of Reproductive Health and other stakeholders within the ministry. And Kenya has submitted actually a proposal for rollout, funding proposal for national rollout. This was is expected to be later next year, in 2018. So maybe second half 2018, 2019,
Yes.
we'll have that rollout that will enable this vaccine to be administered to our girls between 9 and 11 years as part of the National Immunization Program, what we call KEPI, the Kenya Expanded Program on Immunization.
Right.
So once that is embedded, then we are able to protect our girls. But right now, the vaccine is available, but obviously, majority of Kenyans will not afford to go and have a dose. The recommended doses by WHO are actually 2 doses apart, but each will cost about 2,000 thereabout. So that may be too much. And again, you know, our people are not socialized to go for things when they are not sick.
Yes.
They don't sick, they don't have any symptoms. So it's something we
don't
need to
do
deal
checkups.
with. We don't do checkups.
Yes.
Yeah, but the rollout is going to be a game changer. Absolute game changer.
Was there any particular reason that informed the decision to do the pilot in Kitui?
Yes, absolutely. There are many factors, and you know the controversy around vaccines in this country.
Exactly.
Every time you mention vaccines, you need to make sure you have all the players, all the stakeholders on board.
Yes.
And the reason why the pilot needed to be done was, of course, to see you know, the acceptability of this vaccine, the response from the community and other stakeholders. And also, more importantly, the costs. You know, it was also looking at this program was being done in schools. Okay, is it more cost effective to do it to go to schools and vaccinate these kids, or is it more cost effective to do it in the health facilities? You know, the static health facilities, the health centers, or the dispensaries where the normal vaccines are actually done.
Yep.
You know, what would work best for this country? So all those are the things that were being looked into during this particular pilot, and then of course that will inform how we roll out the program. You know, later next year, 2019. And how much it's going to cost us as a country. In as much as we are seeking funding, we expect to meet the funders halfway. That's why we talk of, you know, their partners. So the Ministry of Health will have an obligation to fund part of it, in as much as the donors will bring in funds. So there are many factors that will be put in place. Yeah?
Why Kitui?
I'm not privy to the decision to pick Kitui, but the fact that it was done in a rural setting,
yes.
as rural gets, would also tell us that what they observed can be replicated elsewhere in other rural Kenya.
So no direct factors that led to that decision being made. It was just a random sampling. Yes. Let's go with Kitui.
Yeah, what happens in rural Kitui would be
could also happen here
in Vihiga or in Kitare or someplace,
or even in Nairobi.
Or in Nairobi,
or even in Nairobi. Gladys, I'd like to come to you. There's someone who's asking a very sensitive question, and with all due respect, allow me to handle it as it has come. Okay. With the signs and symptoms of cervical cancer comes the discharge, which usually has a certain smell. And David did mention that at times sexual activity can be painful. In this regard, to what extent were you able to mitigate the kind of effect, even on self-esteem and everything, that came with this particular signs and symptoms? How were you able to overcome that?
Okay. Let me say, number one, we ignore some things. Ignorance. Perhaps when you get these, the discomfort, you're like, perhaps it was my possession. Perhaps I was not ready, you know. But now when the discharge came, it made me uncomfortable. Because there was a certain time that I'll be aware that it is about to come. So I was getting myself always in pads, because I don't know when the discharge will come. And sometimes, if I'm not ready if I was not prepared, I've messed myself. So that discomfort now made me now go to the doctor. Then when the discharge started having this smell, now I was like, even like we are sitting here, I'm like, you people are noticing that there is
A problem.
a problem with one of us, and then I know it's me, so I felt so uncomfortable. Then now I had to seek the doctor's advice very fast.
Yep.
Yes.
Doctor's advice very, very fast. And you
Yes.
said your psychosocial support was awesome. Like people
Yes.
came in and they supported you
Yes.
throughout.
Yes.
But again, even we say, what was the level of support that came from Gladys herself? What are those things that you had to do as someone who's going through this condition so that you're also able to support yourself to overcome it?
Thank you for the question.
You're welcome.
Number one, let me say the reaction. First, I said it was like a bullet. I've never been shot, but I felt, yeah, no, I'm just about to die. Because cervical cancer, the name cancer. And I thought the doctor was harsh. She should have used a politer word than telling me that I have cancer cells in my cervix. I thought she was so harsh on me. She could have used a politer word. I even got scared. I didn't even know how to tell people. I had just come from the office, gone to the doctor, and I told my colleagues, I have an appointment, I want to see the doctor, I want to see my doctor, and now how do I tell them what my doctor has told me? First, I called my husband and told me we have to meet, we have to talk. And when I told him, he was like, okay, we need to seek more advice from the doctor. And we went, they talked to the doctor, and then after that, he just advised me to, Gladys, just accept. If this is what the doctor has said, let's accept the situation. It was difficult. It was not easy. Number one, I knew of people who had lost their lives because of cancer. And now you're telling me to accept. It was difficult.
Right.
I didn't even know how to break the news to my daughter, who was a teenage by then. I did not even know how to tell my parents. But in Aga Khan, there is a cancer support group that meets every first Thursday of the month. So even that time that I was lost, I didn't know what to say. I didn't know how to accept. I heard about this support group. I went and attended one. It is on first Thursdays of the month at 2 p.m. I went and I was so eager to see the survivor, cancer survivor. So survive, so there is somebody who has made it. Somebody has fought the battle. I was very eager to meet the person. And we were seated in a semicircle like this, and we were introducing ourselves. My name is Gladys. I was diagnosed in this year, like that, and somebody said, I had cancer stage 2B, and I've gone through chemo, through the radiation, and I was like, yes, this is a person I need to talk to. And immediately the meeting was over, I got hold of the lady. I asked her, tell me more about your treatment. And she told me. She went through chemo, through the radiation, and she has finished the medications, and now she has gone through the repeat MRIs, and she's confirmed that she's completely healed. I was like, God, you've healed somebody. This somebody you've healed, God, you're also healing me.
Sure.
And from there, all the negatives were wrapped out from my mind. And I was so positive that if God, you healed. I read in the Bible that God used to heal. Whenever Jesus walked, he went doing good. He healed the sick. That was in the Bible. Now, God, you are healing. You have just healed this lady. You healed her yesterday. Today, God, you are healing me. And from there, everything to me was positive. Those who are dying, they're dying for their own reasons. But me, God, I believe that you're healing me. And that gave me a turning point. I could hear somebody, we've lost so-and-so because of cancer. Yeah, okay, sorry, I work in Aga Khan Hospital.
Yes.
And there in the hospital, I used to hear many people, some staff, we lost some staff through cancer. But me, I said, God, you're healing me. I always reminded God, I have a small baby. Let her know the mom.
Yes.
God, give me the chance to see my daughter coming up. God, here in Aga Khan, I have not heard of a survivor studying like I have been healed. That is, I think, and that is why we have so many people negative. You are diagnosed with cancer and you start just looking at it negatively. This is a fight we have to fight. And we have to fight positively. Number one, if you are positive, okay, and I also thank God for the nurses who are taking care of me. They were encouraging us through the treatment. They used to tell us, you know, even when you are so down, when people come to you, they're like, Pole Gladys, I'm sorry for what you're going through. But they won't help you. But the moment you yourself, even if you're feeling you are down, show them that you're strong.
Yeah.
And they'll take you strong. And they'll keep encouraging you.
Yeah.
But when you are down, they'll come and like, you have no hope.
Right.
And if they show you that, if you show them that you have no hope, they are not the ones to give you hope. It has to come from you.
Itoke ndani.
Itoke ndani yako.
Absolutely.
Ndani yako.
Yes.
Yes. Because what is inside you is the one that can either keep you strong or make you fall down.
That's true. It's
I
actually
really
said,
thank God.
it's actually said you cannot pour from an empty cup.
Yes.
So you need to fill yourself first
Yes.
before you can even think of either getting more from outside or now using a story like yours to pour to the world and inspire so many who are watching us this morning. We're about to wind up, David, and I'd like to come to you on the issue of awareness.
Yes.
Only 3% of women have sufficient information about cervical cancer. A whooping 97% do not. What do we do to raise the levels of awareness about this condition?
One of the things we need to do as a people is to keep these conversations, you know, like having this on Good Morning Kenya, but not just having it during the Cancer Awareness Month. There are very elaborate plans and works in the National Cancer Control Strategy that was recently launched in terms of keeping public engagement about some of these conditions, especially something like cervical cancer, having a sustained campaign, a structured, well-designed campaign to ensure that from January to December, we are getting our women to go and have screening. Screening is available even at the level of the health center. Like I mentioned, there are very many modalities. There's screening using visual inspection, using acetic acid. Sometimes they actually see and treat some of the minor lesions. And if they see any minor advanced lesion, then they will obviously refer these women. And that is at the level of the health center. A lot of programs have happened. Actually, it's a lot of work that has happened around cervical cancer in the country. I know the awareness levels are still low, and we need to deal with issues around stigma as well in getting women and also getting even high-profile women to talk about pap smear, to talk about going for cervical cancer screening. Just put it out there that it's okay to actually go for pap smear. So we, you know, as a country now we have lots of even these women reps, a lot of women representatives elected. This is an agenda that would help us advance, especially at their level as people we are looking up to, you know, talking about cervical cancer screening and information about cervical cancer, that really the fact that HPV is sexually transmitted should not be a reason not to go for screening or not to report any symptoms early.
Yeah.
You know, dealing with all these myths, especially in rural communities, but even surprisingly, even out here in a very well-educated population in the urban centers, that will not go for a pap smear or a VIA, the visual inspection testing. A lot of those things are within reach. They are affordable.
Yeah.
And the other things is it makes sure that this is entrenched in the counties, you know, so it's not something that the national government has to break down all these policies and strategies and all these. Let the counties handle that. Actually, cervical cancer is what you'd call a low-hanging fruit in terms of how to deal with. Counties are able to invest in equipment to see and treat. You know, they are able to invest in training their staff to undertake all the screening.
Yep.
And the health promotion officers are able to mobilize women to come out and not to wait for any magical month. There is no magical month. It can be January, it can be March, it can be any time having these conversations in terms of screening, but also getting people like Gladys here who have been treated, you know, successfully underwent chemotherapy, radiotherapy, surgery, which are the mainstay of treatment, but getting them to talk about it, to say, look, she's back to the office.
Yes. I
I know women who have survived, who were treated for cervical cancer 10, 15 years ago, 20 years ago. You know, it's way behind them. So it's a disease that, unlike other cancers, there are many ways of attacking it. You know, getting our girls vaccinated for those who can afford it, and getting them once we get the rollout done. You know, and annual pap smear is something within our reach.
Absolutely. Thank you so much, David. As always, it's always a pleasure speaking to you. And Gladys, thank you so much for coming. Wish you all the best in both your present and future endeavors. I think you're no longer a survivor, you're a warrior.
I'm a warrior.
You've
yeah.
overcome.
The
Hero.
best one to use.
Absolutely.
Yes.
And thank you for watching the show this morning. That has been a conversation on cervical cancer. Again, we do apologize. We were expecting a gynecologist and oncologist, Dr. Nelly Mugo, but due to some unforeseen circumstances, she was not able to join us this morning. Maybe another day, another time, she will come on set and we shall have a bigger and more elaborate discussion, even when it comes to the treatment and diagnosis of cervical cancer. My name is Samuel Njoroge. Thank you for watching the show this morning. God bless you all abundantly, and see you tomorrow bright and early for yet another episode of Good Morning Kenya.